But even you, Senator, you take millions of dollars from, for example, credit cards and banking companies, and then you sit on a committee that regulates them. And so my question is, Barack Obama and these people making all these promises, and you're making a nice presentation with charts. The fundamental problem that I have is how can we believe anything that you politicians say? How can we believe that when we know that the money is just flowing into your pockets, and that a lot of your time is spent, with lobbyists and taking money from these people in Washington that are not North Dakotans? How can we trust them? How can we trust them?
I think in the 29 years I've served the people of North Dakota, I've demonstrated that I'm trustworthy. Over and over and over. The system of campaign finance that we have was not designed by me. I have to live by the rules that exist. You've been a candidate. You accepted contributions. You accepted contributions from special interests. Somehow you weren't tainted, but everybody else is.
Well, wait a minute.
You've raised the point. I get the answer now.
Well, I'll answer your question then.
No, this is my meeting. I'm here to answer questions. So you've made the charge, sir. You've made the allegation. I think my record is clear as it can be, that I've done my level best to represent the interests of the
Senator, my name is Deborah Pasqua, and from Bismarck. I've lived in North Dakota for about 24 years. And my short story is that I, like many other North Dakotans, have a chronic health condition. And historically, my medical costs and my prescription costs have amounted to about $400 a month after insurance pays. I've always worked full-time. And about 5 years ago, unfortunately, my medical costs forced me to end up going bankrupt. And that was embarrassing. And of course, it's hard. If my car breaks down or something now, I'm kind of in a bind. But going forward, what I would like to say is that I'm disappointed, Senator, that you're spending so much time, so much of your time going against the public option instead of trying to make it work. President Obama is very much in support of the public option. Many experts have said that your plan will not significantly bring down medical health care costs. I feel like that you're not representing me as a North Dakotan, because we all know that the public option will be large enough to compete with private health insurance companies. I worked for a health insurance company before. I do know that Medicare was much more efficient than how the health insurance companies were run.
Let me just interrupt you there and ask this group. How many here are for public option? How many are opposed? Look, I've just been all over the state of North Dakota. 25 meetings. What you see here is pretty representative of what I've seen. The fact is, people in North Dakota are not supportive of the public option. So, look, I represent the people of North Dakota. It is very clear, as I've traveled the state, that the vote you just saw here is very representative of all across the state. Number two, the task I was given, the assignment I was given, was to try to come up with something that would bridge the differences. I've done that. And I think it was the right thing to do, because there clearly are not the votes for public option in the United States Senate. And, I can huff and puff, and a public statement of where they stand. So, finally, the thing that's most ironic, strikes me about this debate, is that the best experts and analysts in the country have told us the public option would make very little difference with respect to cost. It is not where the focus of the effort should be if we really want to reform the system. Somehow this has taken on a life of its own that's way out of proportion to what the best analysts tell us public option would accomplish.
Okay, I'll respond. Thank you for interrupting me. Okay, first of all, I think that a lot of people are not for the public option because they keep being told that the public option will take away their choice of physician and their choice of insurance. And that's simply not true. It's common knowledge that that's not true. Also, they're under the impression that public health option could not be passed. When we do know that if a cloture was voted for within the Congress, that it could be passed with 51 votes. So it's not a problem that it cannot be passed. It's a problem that people don't want to pass it and make it work to the best of their ability.
Okay. Yes, sir.
I don't know the answer either, but I worked in a medical institution 12 years ago. I was in maintenance there, and I couldn't afford their insurance for my family. That was one problem there. You would think you work for a medical institution that you would have free access to whatever medical you needed for the family. I am now employed with Bobcat, which we have Blue Cross Blue Shield. When I left the medical institution, I went to Bobcat. I paid less than $10 a month for a family plan. Now it's $300 to $400 for a family plan, and that's my portion of it. But I still like that option.
Okay.
People have that.
I'm Bernice Thomas.
Okay. Yes, ma'am.
I thank you for spending so much time with this situation. Thank you very much.
Okay. Yes, ma'am.
I know that the health committee and
Okay. All right.
apologies, I'm Amy Ingersoll. I'm from Bismarck. I grew up in Grand Forks. I know that Senator Schumer, I believe is his last name, in the health committee, did have provide a bill that had for the public option, again, that was based on negotiated rates. Is that something that you would vote for if it was included?
No, I wouldn't, because I know exactly where that's going. We've seen what happened in the House. The negotiated rates were tied to Medicare. And as soon as you tie reimbursement to Medicare, that is a very serious problem for North Dakota. The reasons it's a serious problem is because we have the second lowest reimbursement in the country. So you tie our reimbursement to Medicare, which is exactly what the House has in mind. And there's a reason for this, because the population centers of the country control the votes in the House of Representatives. And they have always shorted us, and they've done it again. And I can't possibly support that. I mean, can you imagine you're sending your representative to Washington? It was during the Bush administration.
And we had Clinton and we had others.